An Agency for Persons with Disabilities presentation. Stop your frustrations. CDC Plus Background Screenings Clearinghouse Basics. Family Cafe 2020. It is a common misconception that parents make up the majority of the CDC Plus workforce. While there are many parents on their child's payroll, they are not the majority of employees within the CDC Plus workforce. Parents must carefully consider if working for their child is right for them. A few things to consider are: 1. No employer taxes means not paying into Social Security or Medicare. This impacts benefits down the road, like retirement benefits or dependent adult child benefits. 2. It may impact benefits for others in the household. Paychecks earned by CDC Plus employees are considered income, regardless of who is providing the service or claiming the hardship of care tax exemption. If there are members of the household receiving income-sensitive benefits, those benefits could be affected if they begin working. 3. Long-term need and potential circumstances must be considered. Discussions regarding long-term needs and potential circumstances are crucial and should be considered when choosing employees. For example, if a parent is the only employee providing care and something happens to them, what impact will this have on their loved one? Before discussing background screenings, we need to discuss employees. As you may know, there are 3 different provider types in CDC Plus: agency vendors, independent contractors, and directly hired employees. In many cases, it is the type of service being purchased that will determine the type of provider you will need to hire. An agency vendor is a business that has already been established and will provide the services or supplies you are looking to purchase. If you hire an agency vendor, you will only be able to control the outcome of the services, not necessarily how the service is provided. The agency vendor has been hired to provide care and will provide the training for their employees and will decide which of their employees will provide the service. There are agency vendors for many different services. A few examples are adult day training programs, referred to as ADTs, dentists, nursing agencies, consumable medical supply companies, etc. Any already established APD iBudget waiver provider, referred to as waiver provider, would also be considered an agency vendor. Agency vendors will send you an invoice stating the amount you owe them for the services they have provided. If the agency vendor you select is already an APD waiver provider, you do not need to worry about background screenings for their employees. The APD waiver provider is responsible for ensuring all employees meet training and background screening requirements. However, if they are not an APD waiver provider, you will need to request a letter of intent from CDC Plus office. Once this letter is completed by the agency vendor and sent back to the CDC Plus office, the agency vendor will be entered into the clearinghouse so that they can conduct their own Level 2 background screenings. An independent contractor is someone who is in business for him or herself, such as an individual or sole proprietor or single member LLC. They will have specialized training to provide the services that you hire them to provide. Just like an agency vendor, you will only be able to control the outcome of the work performed. Most of the time, an independent contractor will provide services like nursing, therapies, or dietary services. These are not the only types of services that can be provided by an independent contractor. Independent contractors will send you an invoice stating the amount you owe them for the services they have provided. You will need to conduct a Level 2 background screenings on an independent contractor if they are not an APD waiver provider, or they are not licensed by the state of Florida and working within their license scope. For example, a nurse is providing nursing services. It is important that you properly classify your employees. You may be required to pay tax penalties for anyone you have misclassified. If you are not sure if a person you are hiring qualifies as an independent contractor or a directly hired employee, you will need to complete IRS Form SS8 and have them make the determination for you. Everyone else you hire will be classified as a directly hired employee, or DHE. A directly hired employee is any individual who is hired directly as an employee, not through an agency. You will be able to control the details of the job, both what and how the job will be done. All directly hired employees will submit a timesheet to you at the end of each work week that shows the start and end times per day for the services they have provided. All directly hired employees are required to have a CDC Plus Level 2 background screening. After choosing a caregiver, now it's time to do the background screening. All caregivers must pass a Level 2 background screening. So let's go over some requirements and tips to help along the way. Prior to employment, all applicants must complete the following. 1. A Level 2 FDLE FBI background screening. It is required by statute that all APD CDC Plus consumers be registered and initiate all employee background screenings within the clearinghouse. 2. APD CDC Plus certification of good moral character must be completed. Affidavits from other agencies are not accepted. You are required to keep all documentation in the employee's personnel file. These are required to be completed initially and every 5 years thereafter. A local law check is not required for the CDC Plus program, but is strongly encouraged that you request one. These local law checks must be conducted directly with and certified by the local law enforcement agency in the jurisdiction where the applicant lives. The local law records can be compared to the Clearinghouse public rap sheet that is available to you for 30 days after the screening, just to make sure that there are no other potential disqualifying offenses for the applicant that has not been reported to the Florida Department of Law Enforcement. If you ever have questions about a potential disqualifier while reviewing a local law, contact the state office APD CDC Plus staff directly. APD joined the Clearinghouse May 25, 2015. The purpose of the Clearinghouse is to provide a single data source for background screening results for persons screened for employment or licensure that provide services to children, the aging populations, and people with disabilities. We will give you some tips to ensure the Clearinghouse really is a great tool for you. Chapter 435, Section 12 of Florida statute mandates the use of and sets requirements for the Clearinghouse. These requirements are: 1. You must register for the Clearinghouse. 2. The employee roster must be maintained. Any changes in employee status must be updated within 10 days. 3. All screenings in the Clearinghouse must be initiated prior to sending an applicant for fingerprinting. 4. Your applicant must have an eligible status prior to having direct contact with your loved one, the consumer. As we all know, sometimes background screenings can take a little longer than we'd like. However, for the health and safety of our consumers and your loved ones, we require background screenings be completed prior to an employee providing services. The registration process can be a little confusing. Here are some tips to remember to make the process easier. The CDC Plus consumer is considered the provider in the clearinghouse. Remember your username, password, and security answer once you register. No one at the Department of Children and Families, Agency for Healthcare Administration, or Agency for Persons with Disabilities has access to your information. If you forget these, you will have to create a new portal account and go through the registration process again. Do not share your username and password with others. Each user of the clearinghouse must have their own portal account. Once you have a username password, you can request access with multiple programs and CDC Plus consumers if you are a representative for more than one consumer. Your registration agreement must be complete. The representative signs both lines as the user and the review and approval by provider. If your registration agreement is not complete, this holds up the process from you getting access to the clearinghouse. Keep your account up to date with accurate information. You will be emailed alerts if an employee gets arrested, is due for a 5-year rescreening, or if there are new results to view. We encourage you to log in every 30 days or at minimum every 90 days. This will assist you in remembering your username, password, and security answer. If you do not have to screen every month, at least log in and check the homepage for notifications. Remember, it takes 5 to 10 business days for approval of the registration agreement. Department of Children and Families will send you an email once it is approved. Once you get your approval email from the Department of Children and Families, you're ready to use the clearinghouse. Here are some quick tips to remember when initiating a new screening, an agency review, or a resubmission of a screening request. Always search for the applicant in the clearinghouse prior to screening. The clearinghouse has been in existence since 2013, so there may be a chance your caregiver or employee is already in the clearinghouse. Once searching, you will know if the new screening must be initiated. For your caregiver, you will be choosing employee/staff person as their position title. With any of these options, remember to print and acknowledge the privacy policy. The applicant must sign this form for your records. If the box is not checked acknowledging the privacy policy, you will not be able to see the final determination. Before sending out an applicant for fingerprinting, always search for a compatible live scan vendor in the clearinghouse. Not all live scan vendors are compatible with the clearinghouse. This creates frustration and is costly to you. Always print the live scan request form to send to your applicant. This form has all the necessary information for your live scan vendors to submit prints to the correct location. It can take up to 6 to 10 business days for a determination to be returned for your applicant. If a screening is taking longer than 10 days, there is a chance that the background screening unit with the Department of Children and Families needs more information from the applicant to complete the screening. Please be patient. Until all documentation is submitted by the applicant, they will remain at a screening in process status. Failure to submit documentation to the background screenings unit by the applicant will result in a not eligible status. The retention of fingerprints provides a cost savings for applicants that are in the clearinghouse that have had a lapse in employment greater than 90 days in a position that requires a level 2 background screening. These screenings are any of the screenings conducted in the clearinghouse. If there has been a 90-day lapse in employment, these applicants would only require a new national criminal history check, which is just a resubmission of the retained fingerprints. The cost of a resubmission is $13.25. A new state criminal history search will also be conducted at no additional charge. You are required to review if the applicant needs a resubmission. You do this by reviewing their employment history section on their person's profile in the Clearinghouse or their resume. Upon the 5-year rescreening, the employee must be screened into the Clearinghouse. Initiate this screening about 60 days prior to the expiration of their current screening to allow ample time for their prints and determination to be made before their expiration date. Also, if your current employee working under a prior Clearinghouse screening is arrested for any reason, initiate their screening in the Clearinghouse immediately to confirm their continued eligibility. Florida statute mandates the use of the roster within the Clearinghouse. Section 435.122C Florida statute states an employer of persons subject to screening by a specified agency for persons with disabilities, must register within the Clearinghouse and maintain the employment status of all employees within the Clearinghouse. Initial employment status and any changes in status must be reported within 10 business days. You are required by law to keep your roster up to date. Maintaining your roster also benefits you as an employer. Having an up-to-date roster will allow arrest alerts for your employees and notifications of employees coming up for renewal to be sent to you. It's confusing when you don't know who must be added to your roster. You will be adding independent contractors and directly hired employees to the consumer's roster. You will not add an agency nor the employees of that agency to your roster if you receive services from an APB waiver provider. Clarent will be looking for your contractors and employees on your roster, not an agency employee. Thank you for joining our presentation. If you would like additional training, please visit the link provided. There, you will find a library of training videos to assist you through the background screening process. Have a wonderful day and enjoy your cafe.